o'clock Eastern, 11 Pacific. I'm Todd Hayden. It's good to have you with us from across the country on this Monday. A new year bringing a new COVID variant. The latest subvariant is being dubbed Kraken after the mythological sea monster. Experts say, though, it's proof positive the virus is still evolving. The World Health Organization says this Omicron subvariant is the most transmissible one detected so far. The Public Health Agency of Canada, meantime, domestically saying last week it's, quote, too early to tell if the subvariant is spreading in the country beyond some scattered cases. Here's what we know. There is new concern in Quebec, which reports 4 deaths related to the disease and a 27 patient increase in hospitalizations. 29 cases of the Kraken virus, subvariant rather, have been confirmed across the country. Dr. Matthew Oughton is my guest, infectious disease specialist. He is in Montreal today. Dr. Oughton, always good to see you. And give me your sense of this variant, Kraken, how it compares to others.
I think this is going to give a lot of your audience a sense of deja vu. This is the latest in a series of variants that is appearing precisely because it has a competitive advantage over the other variants that up until this point have been the dominant ones. And just like we've seen happen many times before, in many countries, we've already seen this process well underway where it very rapidly emerges from almost nothing and then in the matter of literally a few weeks becomes a dominant strain. A good example is the example just to the south of our border, where I think it was in the course of about 3 weeks, and this went from about 1% of all of the variants isolated to upwards of 40%. And in some regions, it's even more problem than that. And I'm certain that we're going to see exactly the same process replicated here across Canada in the next couple of weeks.
The virus more transmissible, as we know, but how serious is it? How deadly is it? What do we know on that front?
So there's not a lot we do know for sure about that. Clearly, based on how it's behaving, I think it's fair to say that this is a more infectious variant, and it's probably the most infectious variant we've seen so far. But that's just about transmissibility, about how well it binds to the receptors in the upper airway and so forth. It doesn't speak to the severity of the cases. And of course, keep in mind that viruses don't cause disease in and of themselves, because we also have the immune system of the patient that they're infecting to deal with. And very clearly, after the months and months of primary doses of boosters, as well as to a certain extent natural infection, we have a population that is more immune now than it's ever been. That's not to say that this will cause zero disease. Very clearly, that's not the case. But I think it's safe to say that the current boosters that we have available to us will still continue to be effective and have shown to be effective against all of the Omicron subvariants. And it's likely to provide a significant amount of protection against severe disease, against Kraken as well.
What do people need to know about Kraken?
I don't think this is going to be much of a game changer, other than obviously for people who may have so far as they know, not gotten infected and have not yet been vaccinated. That's obviously a very small proportion of the country. But for people in that setting, as well as people who are profoundly immunocompromised and therefore probably don't receive as much benefit from vaccines, in those two circumstances, this is still the most infectious variant that we have. Therefore, the stakes for those groups, I think, are still very high. If you're in that first group, those who haven't been vaccinated yet, there's still no time like the present to get that process started. And if you are one of the people who are profoundly immunocompromised, clearly take the emergence of this very infectious variant seriously. If you think you're sick, get tested promptly, because even if vaccines are of less utility for people who have weak immune systems, we still thankfully have other treatments like oral antiviral medications that seem to have retained their effectiveness against all these subvariants we've seen so far.
Dr. Matthew Oughton is an infectious disease specialist joining us today from Montreal with the latest on this subvariant that's been dubbed Kraken. Thank you, Dr. Oughton, as always.
My pleasure, Todd. Thank you.